We talk a lot about what kinds of things keep people from being healthy. There are an awful lot of challenges facing the healthcare system today, and I think just about everyone in it or near it would acknowledge that it's broken.
The field of primary care is really at the forefront of change in medicine in the U.S. The biggest challenge we have in our healthcare system is how can we affect those things that we know have profound impacts on health, things that happen outside of my office.
While we have some capacity to address those things through health education and the like, we need much better organized and effective capacity than health centers have now.
Your environment plays an important role in your health, and lifestyle changes like quitting smoking, losing weight, exercising more, eating more healthy. How can we begin to address those things from the standpoint of primary care?
Our job as primary care physicians is to eliminate the barriers between our patients and their health, and we can't do that in the exam room. We can't. It's an issue of justice. We should be, as physicians, addressing the essential injustice in the way healthcare is delivered in Rhode Island right now. A neighborhood health station is a really, really cool thing.
A neighborhood health station is our idea for how we want to transform healthcare in America.
The general idea of the neighborhood health station is that you have as much stuff to keep people healthy under one roof as you possibly can.
It's not a neighborhood health center, although it provides medical care, and it's not a YMCA that supports healthful living. It's a building that does both.
Neighborhood health stations represent what we want primary care to be.
So there'll be a nutrition class, there'll be exercise classes, there'll be financial literacy counselor,
dentistry, pharmacists.
There'll be links to community service agencies.
Whether it's you want to see your family doctor or whether it's you want to see your health coach, everything you need to stay healthy and everything you need to get out of healthcare, neighborhood health stations will have.
They provide a range of primary care, but they're also functioning as a community center, providing wellness and preventative health programs like, say, a pool or a gym. So from physical health to social health, mental health, all in one place. It's really a one-stop shop, I would say, for health.
Each neighborhood health station will take care of 10,000 to 15,000 Rhode Islanders, and they'll know those people. They'll know the salient issues in your community and target interventions to address your health. Neighborhood health stations will also have extended hours. We want to be there for you on your time frame and deliver the care that you need when you need it.
Here's this place where the people speak your language. You look around, you see people who look like you because they're from your community. There's kids playing. There are people looking up from the desk smiling at you. What do you feel? You feel welcome. And that's a huge part.
I don't care if we call it community health center or health station or community health station, just so it has these additional capacities in its next evolution.
It's going to be easier for patients to get what they need in a setup like this. Despite some good efforts, like patient-centered medical homes, we have a glaring lack of access to key services in Rhode Island right now.
People hear the term medical home and they think it's a home for the patient or home for the doctor. It's really simple. The medical home is a place for the data. Who's accountable for it? And how do you hold it in a place where everybody that needs to work on the patient has access to it? And so that really begins to fundamentally shift what it is we do in healthcare. If you take it out into a community, it becomes a very powerful tool.
The primary interest that we have in the health station, connecting healthcare to wellness in the community and vice versa. We want to make that connection because we feel that we're working in isolation and we're not working together.
I'm interested in starting a neighborhood health station because I think it's wrong that people can't get what they need.
Sí me gustaría que todo estuviese en un solo sitio, no solo por mí, sino por muchos que no manejan, que no tienen un medio de transportación para ir a la farmacia, al médico. No solo para mí, sino para todos, para tantas personas que no manejan, que todo le quede más cerca.
Nosotros tenemos a Progreso Latino, pero necesitamos como sitio para hacer ejercicio.
Health is something that is vital in the community. Without health, you can't have a productive economy, you can't have kids learning in school. I think that's why leaders in the community are so engaged and want to see a health station happen here in Central Falls.
A neighborhood health station in our community would be very beneficial because employers want to come into a community that has healthy residents, people who are able to work and have access to this healthcare resource will allow them to also enjoy the benefits of lower healthcare costs.
A community like Central Falls is in great need of this kind of programming. It's a poor community. They need more resources, funding sources like government. They just need the manpower, they need the expertise to get into the community and make it work.
We have the ability to help invest in the state and to invest in things like this. This is literally something that would be good for potentially all of Rhode Islanders, all of the economy. I think what also is unique about this, given that Rhode Island is a small state, it can be achieved. So we could have a broad impact.
It really would be a model for the rest of the country.
We hope that the legislature would vote for mechanisms to fund something like that, and if people understand how it's going to work, it may help to build the first one.
Neighborhood health stations could definitely be a game changer on a national level. If we can show that we can do a better job of primary care and a better job of taking care of you and your community, then we will have accomplished something very significant, and we will have created a new model for primary care in the US, and a model that really captures the culture of health that we want to create.